In this video, we will learn about case-based fever and rash surveillance for measles and rubella.
Measles and rubella are vaccine-preventable diseases. 2 doses of MR vaccine are recommended under immunization program at the age of 9 months and 16 to 24 months respectively. Both measles and rubella have been targeted for elimination. To achieve this elimination goal, country transitioned from outbreak-based surveillance to case-based surveillance in 2019 and to fever rash surveillance in 2021. Measles and rubella both are highly contagious diseases amongst humans caused by viruses. Both diseases are transmitted primarily from person to person via air droplets. Measles virus remains present in the air for 2 hours after an infected person leaves an enclosed area. Suspected measles-rubella case presents with fever and maculopapular rash. The incubation period for measles is usually 10 to 14 days from exposure to symptom onset. The most infectious period is from 4 days before to 4 days after the appearance of rash. Rubella, however, is not as aggressive as measles. 20 to 50% of infections are mild and asymptomatic. The incubation period of rubella is 14 days, with a range of 12 to 23 days. Apart from the congenital infection, rubella is a mild self-limiting illness that usually occurs during childhood.
The clinical features of measles is divided into 3 stages.
The first stage, which is the prodromal stage, accounts for symptoms like fever, cough, coryza, conjunctivitis. In the second stage, dusky red-colored maculopapular rashes, like these, start from behind the ears and spread from the head to the trunk to the lower extremities. Finally, the third stage, which is the post-measles stage, is characterized by common complications like ear infection, diarrhea, bronchopneumonia, encephalitis, etc. The symptomatic rubella cases exhibit mild fever, malaise, cervical group of lymph node enlargement, and arthritis are some observable symptoms in adults. Infection occurring just before conception and during early pregnancy may result in miscarriage, fetal death, or congenital defects known as congenital rubella syndrome. This syndrome can cause problems like growth delays, cataract, deafness, congenital heart defects, and intellectual disabilities in the child born. Case definition of suspected measles-rubella case is: any person is presenting with acute fever and maculopapular rash, or any person in whom a clinician or health worker suspects measles or rubella infection. All suspected measles-rubella cases with onset of rash with the last 3 months should be immediately reported to the district immunization officer or surveillance medical officer of WHO, NPSP by phone call, WhatsApp, email, SMS. Name, age, sex, symptoms, date of onset of rash, address and mobile number of the patient should be shared. Immediate notification of suspected cases is essential because important activities including immediate case investigation, sample collection, and active searches for additional cases in the community can be ensured without delay. All suspected measles-rubella cases must be investigated using case investigation form by DIO or surveillance nodal officers within 48 hours of case notification. For laboratory confirmation of measles and rubella, serological tests are used and usually blood is collected within 28 days of rash onset through venipuncture. However, for genotype characterization of measles and rubella viruses, collection of throat swab or urine or nasopharyngeal swabs are recommended within 7 days of rash onset. Both measles and rubella infected people should refrain from meeting healthy people and maintain good hygiene to prevent transmission.